counselor. She will help us in the psychological aspect of the discussion today. And also we have the esteemed Sayalay Susila, who has agreed to speak on this difficult topic. So I've been chasing her for last 4 or 5 months, and finally she agreed to help us on this topic. So before we start, I want to invite Sayalay to pay homage to the Triple Gem. So the floor is yours, Sayalay.
Okay, so let us hold up palm first, and we pay homage to Triple Gem and take just 3 refuges. Okay. Namo tassa bhagavato arahato samma sambuddhassa. Namo tassa bhagavato arahato samma sambuddhassa. Namo tassa bhagavato arahato samma sambuddhassa. Buddhang saranang gacchami, dhammang saranang gacchami, sanghang saranang gacchami, dutiyampi buddhang saranang gacchami, Dutiyampi dhammang saranang gacchami, Dutiyampi sanghang saranang gacchami, Tatiyampi buddhang saranang gacchami, Tatiyampi dhammang saranang gacchami, Tatiyampi sanghang saranang gacchami. Okay.
Satu. Thank you, Sayalay. So as usual, the format is that I'm going to have a 10-minute presentation, and the discussion will evolve on a case, but the case is not maybe not specific, and Sayalay may not answer based on the case. So let me share my screen. Okay, you can see my screen, right? Anything? Yeah, if it's okay, then we'll start. So the topic is on prevention and the first aid and maintenance on suicidal ideation, thinking about suicide. So I have a medical disclaimer here. The information presented in this presentation is for educational purpose only and is not intended as a medical advice. It should not be used to diagnose, treat, or manage any medical condition. Always seek the advice of your physician or other qualified health care practitioner with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or heard in this presentation. The presenters and organizers disclaim any liability for any adverse event resulting from the use of the information contained herein. So use the information today as a framework or guide to improve our own mental well-being and also our family's mental well-being. So the agenda of our talk is to raise awareness of mental health, and prevention is better than cure, and providing spiritual toolbox for mental health. And lastly, you are not alone in this community. So I want to give you some statistics. In Malaysia, these are statistics in Malaysia in 2023. It shows that 1 in 6 children experience a mental health problem. And the burden of mental health problem among children has doubled since 2019. And this also shows that about 1 million of people in Malaysia, about 4.6% of Malaysian aged 16 years and above have depression. And the number has doubled during the pandemic. And about half of these people, about 500,000 of them, have thoughts about hurting themselves or being better off dead. And this is the statistics. You can see that you expect that old people has more of this problem, but it's not true. From 16 to 30 years old, it's double compared to the rest, 7.6% probability. So high. So I'm going to present this case. Is Mr. Po, and he is a 42-year-old male, part-time accountant, single without children. So I asked him what are the main concern or issue that brought him to see me. Financial problem which leads to overthinking. So even though he's an accountant, he was scammed 3 times and lost all his money, and he has no property, and currently renting a room in KL. His health, recently he has a knee injury from after being assaulted at the gym in September 2024. After that, he was not able to sleep well, and sometimes can't even sleep. Spend about 1 to 2 hours not able to sleep. And how long has he been experiencing this issue? It has been a decade, but lately after the assault, it become more severe. Are there any triggers or events that seem to make his symptom worse after the assault? So before that, he was struggling, but after the assault, he's even worse. So what are the effects on his daily work? He is unable to concentrate. His relationship is worse with his family and siblings. Self-care and loss of self-esteem. And does he have medical problem? He has high blood pressure. He has a kneecap surgery for the injury. And so mainly some pain in the knee, but he still can walk with some chronic pain. And this is taking medicine. He's taking amlodipine for blood pressure and no previous psychiatric treatment. Does anyone in the family has history of mental issue? None. Any experience? He currently has depression, anxiety, panic attacks, hyperactivity, and also suicidal thoughts. He has no psychosis. So this is a medical term. Psychosis means that hallucination. Hallucination means that problem with their senses. They see things that we don't normally see, hear and taste or feel something. Delusion means a delusion of concept. They think that they are Jesus or God or they are the Hitler or Xi Jinping. So these are delusion. And so never had attempted suicide. There's no self-harm behavior, anger or violent behavior. So he has a lot of sleep disturbances, and there's some erectile dysfunction, and also bisexual, and so some sexual identity disorder. Have you ever been diagnosed with a mental health problem? No. So is he seeing a counselor? Yes, since after the assault. So the government hospital allow him to see because worry that he may have a psychological impact after that. Social history, who does he live with? He's staying alone, so loneliness is a problem. Describe his relationship with his family member. He's elderly, lives alone in Johor. He is the youngest of 4 children, and it's not a relationship are not good with 2 elder brothers in living in Malaysia and sister living in Japan. Do you have a strong support system? Not really. Do you have financial problem? Yes, a big major concern is his money, and recently being scammed and also assaulted. Any legal issue? He's taking legal action against the attacker. And where did he grow up? In Segamat. What was your childhood like? Is traumatic and also very chaotic. And he said any form of trauma, abuse or neglect. He said yes, but I think it's not really. I asked whether he didn't want to share, but it's not really sexual abuse. It's more like verbal and also a little bit of physical abuse, maybe neglect. Were there any developmental concerns? He said yes, but he didn't really elaborate. So has he, assault and insult. Has he ever been a victim of violence or abuse? This we discussed earlier. Yes, sort of. Okay. How would you describe your mood? Is I feel agitated, and he felt like he's easily triggered, and he also feel irritability, mood swing, hopelessness and helplessness, paranoia, and extreme suspiciousness. So he also suspect that the police are looking for him, even though there's no good reason for that. Because he said that the police suspect that he may have money laundering crime. So I think that's more delusional. Sleep patterns 0 to 4 hours and falling asleep difficult. Yes. And then appetite had changed and he had put on weight, but recently he start to lose weight. There's no money to buy food and he eat once a day. And do you experience guilt or preoccupation with food? Yes. What are your expectations to be better and peaceful sleep and able to face the challenges, to eradicate fear and worries. So he's against Western drugs and has strong suspicion that it can harm him. Okay, so this is a myth and misconception about those patients with suicidal intention. But this is backed by psychological research and mental health organization. It says that people who talk about suicide won't do it. So many people who are suicidal express their intention before attempting or dying by suicide. So talking about suicide is often a call for help and should always be taken seriously. Suicide happens without warning. So the fact is that while some suicide might seem sudden, but most people show some warning signs such as withdrawing from others, changes in behavior, mood swings, and talking about feeling loneliness, hopelessness. Only people with mental illness consider suicide. It says here, while mental illness, depression, bipolar increase the risk, not all people who die by suicide have diagnosed mental disorder. Life events like trauma, financial stress, or loss can also contribute. And talking about suicide will put the idea in someone's head. So it says here, asking someone directly about suicidal thoughts does not increase the risk. In fact, it may help the person feel heard and supported, reducing the chance of acting on those thoughts. The suicidal people are determined to die. Most people who experience suicide are ambivalent, so we are not sure. They may not want to die, but want the emotional pain to end. This is why intervention and support can be highly effective. And the last one is if someone seems better after feeling suicidal, they are no longer at risk. So this is wrong. A sudden dip in mood can sometimes signal that the person has made a decision to attempt suicide. It's important to continue monitoring and offering support even if they seem better. So this talk today will be recorded, so I'm reading it very fast, so you can go through it later to look at some of this picture. And so you must seek help when it's serious. So how do you know that your problem is serious? So you should seek help from a psychologist, psychiatrist, counselor to give you support. When this symptom persists for more than a few weeks, the symptom interfere with your daily functions at home, interaction with your family, work, self-care and others, cannot take care of your own hygiene, and worsen over time. This is something they have to worry. If there are signs of suicidal thoughts or behaviors, contact a mental health professional, call a suicide prevention hotline. So sometimes the patient may not want to seek help, but if you are friends or family, you can encourage them and motivate them to do something. So for this gentleman, the mundane issue here, so he has some health problem. So the health problem is a physical health with some pain, and second thing is mental health, which is all this issue with his family, and so this the physical and the mental part of the health. But his biggest problem is money. So even though he's an accountant, but he's very short of financial freedom. Thirdly is a social interaction with the family, workplace, friends. So some people will fight with others. In his case, it's more of loneliness and time. So in his case, he has three of these major problems. But from my assessment, I think his physical health is not too bad. But for him, he thinks that the pain in his knee and the hand is an important thing. So sometimes we cannot assume that the pain is a minor thing. To me, it's a minor thing, but to him, it's a very serious thing. So everyone has a different interpretation of their problem. Okay, so these are dangerous early signals. I think I won't talk about it, and you can read on your own when you go back and listen to it. Okay, so now you I've stopped my sharing, and I'm going to ask Sayalay, invite Sayalay to talk about this suicidal ideation and also consequences of suicide from 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 the Buddhist point of view, especially on karma and rebirth. So I will stop here. So Sayalay, the question is on that.
So can you repeat the question? what is the karma result, right?
Yes, the karma and also the consequences and also the karmic effect and also the rebirth consequences.
Okay. So I think as a Buddhist, we all know that killing is unwholesome, right? Everybody know that, and including killing oneself is very unwholesome. So if one kill oneself with anger and die with anger, then the possibility to the possibility rebirth is the rebirth place for this person is can be hungry ghost, can be hell, or can be animal, right? Depend on how great is the dosa. This is the consequences for next rebirth. And not only that, once a person who has committed suicide, he left a mark in his heart, in his perception. He left a mark in his life, in his mental continuum, so that next time, suppose after this person escape from the health or from hungry ghost, the realm of hungry ghost, and reborn as human being due to certain good karma that he has performed in previous life. And this mark, the mark of commit suicide, that mark will remain in his mind, that he may have that inclination to commit suicide again. He may not know why. No, he has that inclination, but he doesn't understand why I think of suicide. That is the mark that was left over from his previous life. I have one student, not student, I have one fellow nun. When she saw her past life, when she was young, she is a female, Chinese, born in China. When she was young, she has the tendency or inclination to commit suicide, which she herself didn't understand why. Until when she was able, because she practiced meditation, she got deep concentration, so she saw her past life. So in one of her past life, she was a general. Then sorry, in one of her past lives, she was a poor lady, and she fall in love with one man, but her mother didn't like. The mother want her to marry with a rich man, and she resisted, but she has no way to go against her mother's wish. Then finally, she committed suicide. And because of this she had committed suicide before, that leave a mark in her mental stream. According to Buddhism, when a person die, one abandon the body, but the mental stream still going on. So whatever we do, whether good or bad, left the mark in this mental stream. So when she was born as in this life, when she was young, she always had that tendency to commit suicide. So this is also one of the undesirable result for us, in this lifetime. So this is the karmic and the result. Karmic of committing suicide and the result one has to bear. However, not all people who committed suicide and reborn as hungry ghosts or reborn in hell, not every people destined in that way. It also depends on his last thought moment. Although he may kill himself, but on his last thought moment, he suddenly, remember some goodness or some good things that he or she has done in this life or in previous life, or she has reflected our anicca or impermanent or formation or whatever good thoughts that she had in her last moment will decide her next rebirth. So although she or he might commit suicide, but during her or his last thought moment, if that mental state is good, then she may not fall into unwholesome or unhappy destination. So, but mostly, most people will be born in unhappy destination. Only few who has, mental strength or who suddenly don't know how to remember her good deeds, then will be reborn in maybe happy destination. Okay, that is the cause and effect of karmic and resultant for those who commit suicide.
Thank you, Sayalay. What are the teaching and practices in Buddhism that can help people to develop resilience in the face of despair and hopelessness? What are the Dharma practices that can make them strong to overcome this helplessness and hopelessness?
Yes, that is mindfulness. Definitely is mindfulness. Dr. Wong, you want to invite another speaker to speak about this also? Not
Yes.
only
Li Ting is here, but I will let you speak first. Then we ask her to speak on this. So you start first.
Oh, you want me to start first?
Yeah, you start first.
Okay. So definitely mindfulness. Mindfulness of the mind. Because before one commits suicide, one may feel hopeless, depressed, and all the negative mental states. So if one can be mindful of one's mental state, look at that mental state. Let's say depressed. So when I feel depressed, so I arouse my mindfulness, try to be aware of my mind at this moment. So my mind is depressed. So I look at that depressed and do not react towards that depression, because mindfulness itself is aware without reacting, silently aware what is happening in your mind without judgment, without reacting, without like or dislike, with equanimous attitude. So when the mindfulness is aware of that mental state, mindfulness does not take that mental state as oneself. So when there's mindfulness, because mindfulness observes very objectively, so mindfulness does not take that mental state as oneself. Therefore, no reaction will follow when one has mindfulness. So I think mindfulness is the only way can help this person to withstand, all the difficulties in life and face it with courage. So with mindfulness, and also with mindfulness, one will not react. One will not react with all the mental state, right? And if possible, one also can reflect the impermanence of that mental state. Whatever mental state arises, is because as a Buddhist, we always believe whatever mental state that arises all due to cause and condition. So cause and condition are impermanent. So whatever mental state that arises, you look at it and mentally incline your mind to know this is a conditional phenomena. It doesn't belong to myself. It is not myself. This mental state is not myself. So you can incline the mind to see it is just a mental phenomena, not myself. Then the mind won't react to it. This is called wise attention, in Buddha's teaching, Yoniso Manasikara. Incline the mind to see whatever appear in the mental state as conditional phenomena, not myself. So just mentally say, oh, not myself, not myself. After you're aware of that arising mental state, then you add one ingredient. You add one more reflection, we call wise reflection, and say not myself, not myself. Then all this mental state, negative mental state, will not affect us. So this is the strength one should develop in order to cope with all this we call up and down of life. It's very powerful. Many of my students have done this and feel very powerful. Okay. And also, of course, important is, if you got support from your environment, from your friend, and you yourself also develop, we call another called Brahma Vihara. The Metta, develop loving kindness to yourself and to other people, and Mudita, and sympathetic joy and compassion, karuna for yourself and for others, and lastly, equanimous, reflect cause and effect, reflect karmic karma and its action. So if we can reflect cause and effect, also we can maintain equanimous. Therefore, I think that mindfulness and mindfulness is the most important. And secondly, we practice this for Brahma Vihara in life, also can make our life, make the life easier, happier. Okay.
Okay, thank you, Sally. Ting, maybe I will ask you later, but there's a question from the floor. She direct messaged me. So I understand what she's trying to say, but I will just put it in the context. So those people who are a meditator and also a yogi, you are always practicing mindfulness and also understand the principle of impermanence and all that. It's from the theory point of view. But usually when they are in this state of mind, their mind is stuck in this depression, all the things that happened in the past, the money. So no matter how you want to ask them to be mindful, they cannot do it. So it's also back to the principle of practice prevention. So we have to practice before it happens. So for those of us who has no problem now, but for those people with problem, I think it's not easy for them to remove it. So the message that comes and say that when a person have suicidal thoughts, it is hard to have mindfulness at that moment as the pain is too great and it feels that it's out of control. And medicines can help calm the person down. So in this case, I think medicine is very important. It's not just dharma and also psychological thing. Sometimes you need the drugs to help you to relax, so that the person have mindfulness and strength.
Because you are the doctor, you should speak on behalf of doctor. I am the nun, I speak on behalf of my practice, right?
Yep. Okay. So that's the comment. And then so maybe Sayalay can answer. If those people who are so stuck, is there at least small steps or practical things that they can do? Because they didn't practice mindfulness for their whole life, and now they have come and listen and they think that they can do something. So what are the small steps that they can do now?
Okay, there's one very easy things which I practice is not mindfulness. As you say, yes. You want to now, I ask you to be aware of your mind, you cannot do good one because that only advanced meditator can do it, right? But there's one small thing which everybody can do, that is which I used to do and I used to share with people. So when I have very acute pain, I think I shared this before and Dr. Wong also know it. When you have very severe pain, then you arouse your compassion. Don't think of your pain. Don't think of your pain, but you think of other people. For me, when I have pain, then I think of those who suffer from cancer. They have more pain than me. Then I don't care of my pain anymore. Then I generate my compassion for other people. May all beings be free from the pain that I endure now. So my mind move from my pain towards other people's pain. So I generate more compassion to others, and of course, including myself. So I say, may all beings who suffer the pain like me be free from the pain. So how this method is applicable to everyone and is very effective. I mean, to me, very effective. And many of my students also follow this method, and also they feel many of the pain, that they have at that moment subside. So this is the one thing which I can share with you. If you feel that to be mindful is so difficult, then you can just take your pain, then say, may all pain, because your pain is so great, it's so strong. Then you say, and so unbearable. So you can say, oh, think of that pain. Other people also have this type of pain, even stronger than this of pain. So think of them, and may all being be free from the pain that I now endure. Again and again, repeat the same thing again and again, then you may see your pain subside or reduce. This is the only thing I can share.
Yeah, I think that's a very powerful principle, and a lot of things that you just said today has been taught many times already. But now we put it in the practical point of view. So just what have Sayalay say is the physical pain, but the mental pain is worse than the physical pain. I remember when I went to Penang for the retreat, one of the lady was able to sit for 3 hours. So I asked her, how come you are able to sit so quietly for 3 hours? He said, this for me is a physical pain. I cannot stand the pain. The answer that she told me was shocking to me. She said, my mental pain is worse than my physical pain. That's why I can sit for 3 hours. So so sometimes the mental pain is more suffering. And I think the principle for this, for you to transfer this compassion to others, you release the attachment to your own body and mind.
Yes.
So when you are too attached to it, the more pain that you have. But now you
Yeah.
transfer it to others, you said others also can be relieved. Then you can be have some relief from it. So now I invite Ms. Saw Lee Ting is a qualified counselor. Is it you have any input on this point on the
Yeah,
mindfulness?
I agree with Sally about the point. One of the common ground that actually both science and spiritually agree on how to reduce suffering is mindfulness. Yeah, like just what Sally mentioned just now. Mindfulness and also social connections and also compassion and self-forgiving. Yeah, and also we need to look for a purpose and also meaning of life and connect with naturals and also reinstill hopes and optimisms. So all these are actually the scientific methods to actually help the persons to actually being more positive. Like when they have they have suffering, actually the in the brain part is actually the amygdala being activated. So once the amygdala being activated, actually the person will not have the conscious mind to solve the issue. They will fall into they will be kidnapping by the emotions. So they will be like, they will generate the emotions again and again. So once we notice that, we actually need to stop that. So by stopping that, actually we need to replace with others things that they can practice. So mindfulness is one of the important methods for them to practice. So according to some research, they found that by practice mindfulness, they can help them to back to the present moment. Yeah, because when they have this, means they occupy with all the issues, they will be like, they will rather focus on the past or worry about the futures. But then it's sometimes all these kind of issues actually not related to the presence. So when they back to the presence moments, they will find that actually they can stay calmer compared to if let's say they keep focus on the past or anxious towards the futures. So mindfulness will help them to reduce their stress. Yeah, will help them to calm their anxious and also improve their mental health. Okay, so, and another thing is social connection, as just what Sayalay mentioned just now. So when they have issue, right, we always encourage them to try to connect with peoples that they can trust with. So especially people they can trust with. If let's say the people they couldn't trust, and when they tell them, they will start worry. Yeah, we want to reduce their worry, so we get the people they can trust. So once people they can trust, that they tell the worry they have faced or the issue they have faced, actually will help them to reduce their worries. And also they can get some support from the people surrounding. If let's say they couldn't find the people to support them, they can call the hotline. Yeah, we have a lot of hotline available in Malaysia. Yeah, they can call the hotline, and they don't need to worry that the hotline people will actually means like spread their issues or what, because they are holdings at ethical practice. If let's say they found that this is a suicidal case, they will probably provide more suitable strategy to help the peoples. Yeah, if let's say the case is actually need more physical support, then they will ask the people to come to the centers to provide more, more helpful support. Yeah, and with social support, actually will help them to release their stress, first thing, and also let them feel connected. Once they feel not connected, they will feel like they are not alone to face the issue. Yeah, they will probably feel not that their issue will not become lower. Yeah, this is something very important. So when they come to the counseling sessions, or when they call the hotline, we will help them to figure out what are their social support as well. We will ask them to list down. So when they have the issue, then they will immediately they know who to call. If let's say they don't know who to call, then they can call to the hotline again. Yeah. So, and purpose and meaning, this one is also very important, because some of the suicidals, they might feel that they don't have hope. They see life is hopeless. So for us, it's actually we need to help them to reconstruct their hope, to refine their hope, and also to figure out what are the hope and meanings, so that they find a purpose in their life. So when they found a purpose in their life, they will focus on the hopes and how to make it work, rather than looking at the anxious or worried. Yeah. And sometimes we also need them to actually connect with the naturals. So when they connect with the naturals, because in the natural they have a very beautiful chemicals help them to actually generate the positive hormones to make them feel better. And also when they go to naturals, then they can actually become more relaxed. Nowadays, a lot of people actually they will like spend a lot of time with social media, with their device. So it's actually not helpful for them because they thought that they can actually like distress from the stress, but actually it's not helpful for them because the brain is not resting. So even though they thought that they are escaping from the events, they won't be able, they will, means their thought will be occupied, their brain will be occupied with all the messages they saw in the YouTube, Facebook, Instagram, but that actually is not helpful for them. What they need is actually to make their mind in a relaxed way, go back to a relaxed stage, but then not scoring Facebook or anything, because that will just make their brains become occupied with all the unnecessary informations. Yeah. It's not going to be helpful for them. Yeah. So, and compassion and forgiveness also. When during my degree time, I do a research to test the relationship, the level of forgiveness in Buddhism, in Buddhist, and also with Christians. Okay, so from the research, I found it's very interesting. Both of them actually they practice in Buddhism, and also the Christian group practice in Christians teaching as well. And then they able to forgive others people's. Both of them able to forgive others people's, and able to forgive the environments. But then for Buddhism, if we found that something's lacking, there is they not easy to forgive themselves. Yeah, and then for Christians, they actually able to forgive themselves compared to Buddhists. So this is something I think maybe something we need to look into. So we need to practice, like just now what Sally Susila told us, that we can practice the metta, metta, to help us to actually to love ourselves first, starting to love ourselves first before we move to others, peoples or surroundings. So we with all these cultivations, we actually will help them to have a better self connections, better connection with the environments, and also better connection with the people surrounding them. So when they have issue, then they can easily for them to find the resources internally and also externally. Yeah, that's all for me.
Okay, thank you, Li Ting. Maybe I summarize some of the things that you said. So some of my patients who had this problem, I asked them to go to the nature and exercise. So I have one patient who overcame her depression by exercising. So she refused to take all this medicine. But the exercise, at first she do about half an hour and 1 hour. So that was able to control his anxiety and also depression. So and studies have proven that exercise is as good as antidepressant in terms of the effect. But because his condition is so bad, instead of exercising for half an hour or 1 hour, he want to control the mental issue by doing more exercise. So he do about 3 to 4 hour exercise. So this 3 to 4 hour exercise is become harmful. At first it's useful and it became harmful to him. So sometimes they have to have some wisdom in things that they do. Another thing that I ask my patient to do, which is what you ask, is go to the nature. So when you go to the nature, so these are for those people who are not able to sit quietly and meditate. So when they go to the nature, ask them to use their senses, their eyes, their ear, and also their smell. So if they see flower, then you smell the flower. You see trees or birds, and then pay attention to the trees and birds. So this is a way of mindfulness when you're out. So when you're at home, everything is so 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 normal to you. It's not something new. So your mind always look for something new and surprises. So when they go out, then you look for all this. So sometimes when you do that, you can you can have this mindfulness practice in nature, and sometimes there are all these complimentary people ask people to do grounding or hug the tree. So all these are also, at first I think these are like very very strange and hocus pocus, but it's also rooted in mindfulness. Because when you hug the tree, you are using your senses to feel, feel the tree, and you think that the tree is like so much compassion and take all your suffering away. So it's a kind of mental treatment. And so how do you know that this is working? Because some of the Western trained doctors or people, they think that this is rubbish. So as I said before in my talk, it's not important whether it's a white cat or black cat. As long as it solve your problem, then it's good enough. So for these people, then I ask them to, when they do grounding with the shoes off, close your eyes and feel it. See whether you feel better or not. And if you hug the tree, you feel it. Just pay attention to your feeling now, your senses and all that. If you feel good, that means it's working. So use your own judgment, not what I tell you that it works. You feel it. So going to nature and also exercise is a very good option for these people, because you cannot sit still and concentrate. It's not easy. Okay, the next question for Sayalay. Also, I think Ting has mentioned before. If someone has hurt you in the past, whether your family or friends, and or your maybe something from your past life, how do you forgive them?
Someone do bad thing to you in the past.
Yeah, so you think that they done something bad to you.
Then how can you forgive them?
Yes, they hurt you, or in terms of physically or mentally, So how do you resolve this? Question for Ting also,
Okay, for me, such thing has never been a problem for me. But if I tell you my answer, I don't think you can do it. Aiyo. If you are the Buddhist, if you are the Buddhist, my answer is something you all don't like to listen one. All right? Anyway, I just want to tell whether you like it or you don't like it. If I know somebody hurt me, injured me, what, I only think this is the result of my past karma. So I can cope with it with equanimity. Because in the past, we don't know. We are not a completely good person, right? We have our defilement. We have our corrupted mind. So in the past, we may have done something wrong to other people. Now somebody done something wrong to me. It's fair to me. I feel it's very fair enough. So I just endure it without giving in to anger, without harbor any hate to this person, because I don't see him as a person who hurt me. I only see this is the process of cause and effect. This is the operation of cause and effect. If no this person, another thing also will happen that cause me, hurt, that hurts me. So I don't see it as a person, but I see it as a cause and effect. Therefore, it's for me, it's very easy for me to solve this problem, but it's very difficult for many of you, because you only pointed to this is he hurt me, he ruined me, he abused me, he scolded me, he bullied me. So all the thoughts of layperson only think of he is the one who hurt me. Therefore the anger never subside. We don't see that way. As a practicing nun, I don't see that way. I see it's the cause. I think it's an operation of cause and effect. Without her, somebody also will appear and make me feel, and hurt me and make me feel hurt. Because I have to pay. I have to pay for my unwholesome karma done in the past. It's very fair. Karma, cause and effect is very fair. Whoever did the bad they have to receive the bad result. So I understand this cause and effect. Therefore, for me to forgive people is very, very easy thing, because I don't see he is the person who hurt me, right? But okay, so can you do as what I do? Therefore, I say my answer is very easy, but I don't think you can do. I have one friend, I have one student who, who was his boyfriend, who stayed together. She stayed with her boyfriend, but her boyfriend betrayed her again. So she feel hurt, so hurt until for 2 years cannot eat anything, and she lost weight, I think more than 20 kg or 10 kg. Every night she told me that every night she think of her boyfriend, her fires burning her body. So she cannot sleep for almost 2 years. And every monk, every retreat, whoever monks she met, she will ask, how can I how to call, ease my anger towards the person who hurt me. She will continue ask this question. Then all the monks tell her that, you have to forgive him, you have to practice metta to him. But none of this method worked for her. Until one day she met with me. Then she said, she asked the same question again. Then I know, somebody hurt her. Then I said that there's no one, it's just a cause and effect. There's no one was hurt, or no one hurt somebody. It's just an operation of cause and effect only. This. So when I say there's no one, no him, no you, no him who hurts you, and no you who are hurt by him, just an operation of cause and effect. Immediately she woke up. She woke up and she said that, all my anger, when I think of this, there's no one, no her, no him who hurt me, and no me who are hurt. When she told me, when I think of no one, just operation of cause and effect, all my anger subside. All my anger subside. No anger, no residue of anger in my heart. And now she and this man become good friends. So, but she can, I believe that if she can do, you all also can do it. So this is my answer.
Okay, Ting, your input.
Okay, I think I will want to practice what Susila told just now. I think that one will last longer. For my when client come to see me because of the anger issue, then the first thing I will do is let them to release the anger first. Means through telling me what happens to them, and then and after that I will let them to understand some to understand the aspect of emotions. We need to say that what is the means when the anger comes, they need to know what is the size of the angers, because sometimes they might not realize that they actually being triggered by the persons. They just react. So once they just react, they won't have a stop power there. So they first need to be aware. But then sometimes client when they come to me, they have this control issue. So I will need to gradually teach them to aware of the anger first. So how would they react when they have angers? What is the physiology reactions when they have angers, and also what make them feel angry? Yeah. So to make them realize all these things, then they will have a more awareness. So create them to have awareness. So and also let them to know that's what they can do if let's say they have these angers. Yeah. So gradually I will lead them to that way, and that's this one is just a short-term solutions. If let's say want a long-term solutions, then probably we need to know why they angry, the value inside them. The value, we need to know their value battles, and then how to move toward their value rather than follows the people's means the people who make them angry. Yeah, so once they understand themselves better, then they know where to focus, then they can live their life better.
Okay. I just want to comment. So sometimes I teach my patient about the power of mindfulness, but I don't use the word mindfulness. I said once you are aware of the emotion coming out, if you are aware of it, you are able to catch it, then you can do a one breath awareness. So you can say one breath meditation or one breath awareness. So you take a deep breath in with the action coming to you, you make the option, the choice of what you want to do mindfully. So if you do that, your option will be more neutral and more positive. If you don't have this awareness, then you can react in a way that they will harm yourself as well because you want to hurt him, but at the same time, you also hurt yourself. So now you put the control back to yourself because you take this one breath before you say out or physically do something. You decide if whether I say this or I do this, what the outcome is what I want. So you put the control back to yourself rather than put the control to unconscious like karma decide. So this is a short mindfulness rather than those sitting. This is a very practical life mindfulness which I teach some of my patients. So there are a lot of questions that come on the chat box. So this lady said that what are the karma consequences of suicide attempt? I think Sayalay has answered it, but I want to add on. Then some people, or I don't know whether it's a Sangha who say, or Buddha has said it, that if you have committed suicide, then this imprint will be in your mind. If you become a hungry ghost, then you keep repeating the same process in your mind all the time. Is it true or not? Question to Sayalay.
Just now I have mentioned, I have tell you my story, my fellow nun's story, that because in her past she committed suicide once. Therefore, in this lifetime, she always have the mind of when she was young. She always inclined when something unhappy, thing happen. She always has that inclination to commit suicide, and she didn't know why until she saw her past life. Only she understand. Therefore, once a person committed suicide, it leaves a mark of desire to commit suicide again in their future life. This
No, I think the question is, let's say a person jump down from a building. So when the person is in a hungry ghost state, they keep repeating this jumping down from the building. Is it true? Yeah, every day they will repeat the same process of jumping down or killing themselves.
It only got inclination only. The mind incline only, but doesn't mean that it happen every time,
Yeah.
It's just an inclination. Compared with other people, he has more inclination only.
Okay. Okay, there's another question. It says that is to reflect on your explanation about cause and effect. It says that if abuse victim take it that it's fair to be abused because of cause and effect, that will be quite sad. It's like I
No. We don't think in that way. The way you think is very different from the way we think. We don't think in that way. Because somebody abused me, I understand it's just it's an effect of my past unwholesome karma. I take it with equanimous without giving in to anger. Because as a human, what hurts us most is our own inner defilement. That hurt us even more, not other people, right? If other people hurt me, if I don't get angry, then I'm fine. But if somebody hurt me, I get very angry, I harbor that anger, and I carry that anger to the next life. It hurt me, my anger hurt me even more than people hurt me physically, right? This is how we see things. It's not that I feel that that is fair, then it becomes sad. No, no, the way you think is very different from what we think.
Well, that's not for me. It's the audience who ask this question. Because sometimes
So you want the audience, no, we should understand that, how to call? As I said before, what hurts us most is our own kilesa, our own defilement. Buddha say, if you conquer 1,000 people in the world, it's better to conquer your kilesa rather than conquering 1,000 people in the world. So as a Buddhist practitioner, we always look within, try to erase our defilement, try to cleanse our defilement. And we have Yoniso Manasikara, wise reflection. We will think wisely, not to get unwholesome mental thought that arise, that occupy our mind, then act accordingly, that it suffer even more. Okay.
I want to just to clarify. I think I understand why the person asked this question, because sometimes if you are in a relationship or in a family and you are in the lower power version, and then if you just give up and don't fight back, the other person will bully you more and abuse you more.
Okay, that is another issue. That I also will fight back. Certain thing I will fight back, but I don't fight back immediately. As a practitioner, I endure first, Then after that, I analyze. If my endurance make this person even worse and not fair, I fight. I always fight. But when there's somebody bully me, I understand it's my own karma, then no, I won't fight one.
Yeah, I think this is also go back to the principle of compassion with wisdom. So
Yes.
sometimes you have compassion, but if
No,
you allow him to do it, he continue to commit
yes.
this negative karma. It's not good for him and also not good for yourself, because you feel so much anger to the person.
Yes.
So the right chemical is that the person who are in the lower power have to be mindful, and if you are mindful, you don't have to say anything. The other person will feel it one. They say, "Wow, this guy is like very very thing." Then they may not want to attack you or bully you. So I think this is a practical point of view. If you have dharma, and if people continue to bully you, once you are mindful and think, the other person will cool down. Then you can reason with him. You said what you are doing is hurting me, and it's not nice, and it's not good for all of us. So by saying the right words when you are mindful, instead of being like lost unconsciously and being bullied all the time, I think there is a solution for that. You think you have anything to add?
Yeah, I think a person being means being an abused and being a victim. Sometimes they might not have this power to fight back actually, so they might need external help. So if let's say the victim actually in these positions I think it's not a one day 2 days. It might take a period of time, become a victim. So when in these conditions they probably need to know that that's not their fault. Okay, this is very important, that to let them know that it's not their fault. They are not deserved to be abused or not deserve to be bullied. They deserve to be helped. So they need to take the first step to reach to the persons who can help them to give them better solutions, to give them to come up with the difficult situations, because they really lack of means a lack of the power or lack of the solutions to help them to come out from the difficult situations. So and even after they come out from the situations, they might have these negative thoughts in their mind again and again. So in this sense, they might need a further help, like from counselor or clinical psychologist, to help them to overcome the sometimes like inner how to say, their anger inside them, they will last quite a long time. If let's say they don't have the method to come up from the incidents. Like say for example, one of my friends being abused, and the abuse is actually not the physical abuse. It means like relationship abuse. So when the person's grown up, then they will see every relationship in with that perspective. So it's meaning to say that they couldn't come up from the situations even they have grown older. They still trapped in the same incidents. The incident happens during their primary school, but then because of they don't have the external resources to tell them how to overcome it, so they trap into the situations until even though they have a lot of strengths, they have a lot of ability to overcome, but then they still stuck into the same situations or same psychological circle again. So for them to overcome that, they actually need external resources to tell them what they can do to help them to process the inner process. So they can attend to like Dharma talk, they can attend to like means mental health talk, or even though they can get support from the mental health worker as well.
Sally, I just want to ask you, some of these people, they are Buddhists, and the example that Li Ting said is very common. So there are something that happened in the past. They know it's not right to have this kind of thinking, and they know all this dharma about compassion and also karma, and also all this attachment, but they cannot remove it. They are dharma practitioner. So what can they do? They know it's wrong, but it's like stuck there. The anger or the unhappiness is so strong that they cannot remove it. So
No, I think I have seen so many people are like that because they don't practice the Dhamma. They don't bring the Dhamma into their practice. They only have theory, but they do not know how to put the theory into the practice. That is the problem. We put the theory into the practice. We digest the Dhamma. They don't digest the Dhamma. This is the problem. This is what I have seen so many people suffer unnecessary. I've talked to so many people, so many depression people talk to me. I have my own way to help them. To me, it's so easy for me. If they listen what I say and follow what I say, many of the problem are solved. So the only thing is that many people, they know the Dharma, but they don't know how to incorporate the Dhamma into their daily life.
the advice that I give some of these patients, I said, if you are really a Dharma practitioner, so I have some patients who are yogi, they smoke. I said, you are a yogi, why you still smoke? You have so much attachment to your cigarette. So those people with all this issue in the past, I say, if you are really a Buddhist and Dharma practitioner, you use that as an object of your practice, for you to train your patience and also mindfulness and all that. And you're so lucky you have something for you to practice. If everything is very smooth and nice, there's nothing for you to practice what. So that's the object of your practice. So
Yeah.
it's a way to to brainwash them, And sometimes the thing that I say to them is that the other person who hurt you and still react in a very negative way, and the reason why they do that because they are also stuck in their attachment. They have no wisdom. That's why they react that way. So you have to have compassion with them because they it's not that they want to do it. They are like stuck there. You see. So that's my advice for them. Okay, there's a question in the chat box that direct to me myself. So it's a confidential thing, but I just want to say, this person said that he wants to share that he has schizophrenia and bipolar disorder, and I've been hit by very violent thoughts and usually it causes a mental health relapse. Since last year, after I started practicing metta meditation daily, it helped to prevent my relapse until now. So metta meditation helped him. Even though I still get hit by these thoughts, I managed to snap out of it because of the metta practice and has prevented my relapse. So it's a very powerful practice if you use it. So thank you for your message. Yeah. Okay.
Okay, can I say something?
Yep.
So now I have been teaching, I've been teaching Buddhism or meditation for so many years already. The more I teach, the more I associate with people, the more I want people to learn metta meditation. Now, almost everywhere I go, I want people to learn first metta meditation. This is really useful, beneficial, not only for yourself, for the harmony, with you and the society, your family, everyone, and it's so practical and so effective and so, and bring you all the happiness, contentment, So I urge everyone, if you have not yet started any meditation, you should start with metta first. Then mindfulness of the mind. These are the two major things that I want to teach nowadays, So everywhere I go now, I'm in Indonesia now. Now I teach them metta a few days. Then after that, I teach them how to be aware of the mind. Because these two things are so useful in your daily life. Then I always tell them that coming to retreat is to learn the method. So master the method, and when you go back home, you have to practice what you have learned in the retreat, and make it your until you really know how to practice all this method you have learned in the retreat in your daily life. Only then you can call yourself a yogi. You can call yourself a good practitioner. Some people they practice in the retreat only. After retreat, they forget everything. So when the problem comes, difficulty comes, up and down of life come, they don't know how to cope. Because they only practice during retreat. They don't practice in the daily life. They don't learn they don't put what they have practiced in the retreat into their daily life. That is I always emphasize as a teacher. So if you have not yet started any meditation, please start with metta. Go and learn. Whoever teach metta, go and learn. Then also learn cittanupassana, contemplation of your mental state. These two are so important for everyone.
Okay, thank you, Sayalay. So if it's so important, and some of the audience here may not be Buddhist practitioner, can you do a 1 minute explanation and tips which they can use it immediately? Once they enjoy the benefit, they will come for the longer retreat. So can you tell us in 1 minute this metta meditation and also the mindfulness of the mind, what you can do in 1 minute? Sorry.
Okay, mindfulness of the mind is very difficult. Even I tell you 10 times, you may not be able to put into practice because we always identify all our mental state as myself, right? And when I'm angry, I think when the anger arises, then we think I am angry. Immediately you identify anger as yourself, you do not know how to practice already. But there is identification with all the mental state as yourself is already deep rooted in our mental stream already. So sometimes even I tell 1 hour, people still don't understand, still do not get it. Not to say 1 minute here, right? So if you really want to learn, there is nothing to do with religion. Huh? No, in my Indonesia retreat here, half of the yogis are Christian, I tell you. Half of them are Catholic and Christian. It's nothing to do with the religion. It's something to help you to live in happiness. It's something to help you to erase your deformment in the mind so that you can live in happiness. This metta and contemplation of the mind, so that you wouldn't react all the time with anger, with greed, with jealousy, with dispute and so on, right? But metta is easy. 1 minute I can tell you, you just relax and may I be well and happy. Wish yourself to be well and happy. Relax and may I be well and happy. Just say to yourself, may I be well and happy. Tell maybe 20 times, 50 times. Then later on, may all beings also be well and happy. You let the energy flow out from the heart. May all beings be well and happy. May all beings be well and happy. And gradually you become very, very happy. It's very easy to do. 1 minute you can do it. Just remember the word, may I be well and happy 50 times. Then may all beings be well and happy. And whoever you see, you meet, mentally you can say, may you be well and happy. Or you can even speak out. When you walk on in a street, you meet with so many people. When you go for, you go for dinner, lunch, you meet so many people. Mentally you say, may you be well and happy. Always keep this in mind. May you be well and happy. That's so easy to do. Less than 1 minute. But it takes it takes times to see the effect, because we are not trained in that way. So soon we forget. We see enemy, we want to quarrel again. Somebody tell something not nice to us, we forget that may you be well and happy. So it practice makes perfect. So once you know the way already, you have to practice it repeatedly. Only then you can see the effect. Okay.
So those people who have such a strong emotion, I think very difficult for you to say may you be well and happy to your abuser and also your enemy, right?
Yes, then we don't do to the enemies first. We do to ourselves first, to our respectable teacher, friend, the person we like one first, until the loving heart is established. Then only we try enemy. We don't do enemy in the first phase. No, never do it. Until you feel that you got confident already, your metta is strong already, only then you do to the enemy.
Okay. There's a question from the Facebook. It says here, sometimes we say things and do things without the intention to hurt the other person, but the other person take it very personally and intend to take revenge. What should we do? Her revenge will be our karma also, right?
If you you tell something without intentionally and other people hurt, if this happened to me, I tell something unintentionally, then the other people think bad of me, I say, I don't care. So sometimes if you ask me how I treat all this, you may not like the way I do it, because I think very differently from many people, and my mind also very strong. I don't care what other people think of me, right? When I don't have intention and somebody think, oh, she's very bad, and how she think of me doesn't affect myself, because my mind is very strong, right? I know myself. So if I don't have intention, then what do you think of me? I don't care. I don't mind. So, but how many of you can behave like the way I behave, right? Very difficult. So sometimes you ask how can I do it now? I can tell you, but I don't think you can follow what I do.
Do you think any input from you?
I think can be seen in two directions. The first one is if let's say the person's means the other person get hurt, then it might be something 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 where we have speak, something where we have speak. So maybe we need to have a self introspection. Yeah, we need to like think back. Say what did we say? So are we doing? Are we not mindful enough to say something that might accidentally hurt the person? So maybe we can do some introspections. Then we try to rephrase on our own how to face the sentence battles that may not hurt people. So that's something we can do. If let's say after we do introspection, we found that it's actually is not our wrong. Is probably the person's perspective or person's projections. When they have something in their mind, they might project. Others people's may purposely hurt them or things like that. Then that's the homework belong to the persons, not us. So we need to know the homework belong to us or themselves. So we dance our part, and they themselves need to dance their part as well.
Okay, good. I think there's a direct message from the audience who has schizophrenia. So he said that the minute I find that I'm not happy with someone else that he's not happy with, he will send the metta to that person. So he said the metta is the one that have solved his problem, because he said that he has committed suicide in his past life, and all these violent thoughts came from the suicide from his past life. And he said the metta meditation is a direct antidote to his mental health issue. And I find out from the personal experience that the root cause of my mental health issue is the karma of killing, whether killing oneself or killing other people. So I think that's a good tips from a person who has this suffering, and it works for him. So metta meditation, as Sayalay has said, is a very powerful method. Another one from the audience says that how to practice contemplation of mental state. Is it in the chanting book? Okay, I think Sayalay have mentioned it. You have to come for the retreat and all that, so she can. And then another comment says that if everything I said is perceived to be harmful or something not nice to others, so everything happened that what he has said, other people will blame on him. What can I do about it? If I say everything is perceived to be harmful but no intention, and the other person think that you're saying the wrong thing. But I think this one you both of you will answer unless you have other things to add in. Sally, you have anything to add on? If not,
No.
then no. Okay. So I will ask you some other question. So what advice would you give to family members or friends trying to support someone who experience the suicidal thoughts and ideation? Ideation means that they say that they want to kill themselves or all that. So what are advice for you to give to family members or friends? Question to Sayalay first.
I think the family have to understand, need to talk to them. Why this person, the family member has this type of thoughts. Find out the cause. Why they have this type of thoughts, wanting to commit suicide. So try to understand them with metta, karuna first. Talk to them nicely. Find out the reason why. What are the difficulty they have, So show them your love to them. Then by talking, you will gradually find out why. Then you solve the problem from the why, the cause. Solve the problem. Know the cause, then easy to solve the problem. If you don't know the cause, how are you going to help this person, right? You cannot blame them. So you have to be I think you need metta. The family member need to show metta and compassion to this person, talk to them nicely, help this person to find out the cause for his suicide thoughts. That is very helpful. I will do like that too. Now when my students, they have problem, they come to me, I listen first one. I don't comment anything one. I just listen. Then I find out, oh, okay, now I understand. And then I will tell why you like that, the cause that. And then suddenly they wake up. Once they wake up, they know the cause, then the problem solved. Usually like the way how I help people. So the family member too, you need to show your love, compassion, listen to them properly, listen to this person carefully and find out the cause of his suicide thought. Okay.
Ting, your input, family and friends.
Yeah, I think Yeah, after we knowing the cause, right, then we can keep them to a safe place. So if let's say they have these thoughts, sometimes the thoughts they couldn't control it. When the incident happens and they don't have this self-control, right, then we need to, during the talk itself, then we need to figure out what are the safety plans that we can have with the persons. Like say for example, if let's say the persons telling us that they wanted to, like, say, jump up from the buildings. So this is something they might do when the incident happens. Then we need to help them to figure out what are the safety spot they can go to, or who are the persons they can talk to when this thought come up. Yeah, so keep them safe, to let them to have other solutions rather than just hurting themselves. So we help them to find out the method to keep them safe. Okay, so after that, we need to be there to listen to them, and also to let them know that as let's say they have the issue, then they can look for us. If let's say we found that we can support them. Yeah. So when they know that they have someone to support them, they have this thought come up, then they know what they should do. If let's say if they don't know what they should do, then they will just click with the thoughts, and then they will the thought will become bigger and bigger, and then is might means it's not helpful for them. So they need to have someone to be there to listen to them, to help them. And sometimes we've also found that the person who listens to them, they actually feel insecure as well. They couldn't sleep. They couldn't. They feel anxious. They don't know what to do if let's say this person call them. Yeah, so the person also need to be calm, to let them know that they will be there, and at the same time they will accompany the person to seek for like mental help. Sometimes the persons feel shame to tell person they don't know, even though they know the help is there, they know the hotline is there, but then want them to walk to the clinic or walk to the centers. They take a lot of courage for them to go there. If let's say there are some people with them to accompany them to the center or to the clinic, they will feel less stress or less burdens or less anxious. They know someone is there. So when we know there's someone who want to commit suicide, then we can help them to connect with the agents, like with the hotlines, with the counseling centers. We bring them to the center as well, accompany them, yeah, and then make sure they are okay, have a follow up, means receive the treatments oftenly until they get stable, then probably should be safe for them.
Okay, maybe I summarize what Li Ting has said. There's once we asked the nursing audience, the nurses, and these nurses were asked, how do you help a depressed person because of cancer, end stage cancer? So the lecturer gave a very good answer that was imprinted in my mind for a long time. So the lecturer said, you don't have to do anything. You don't have to know what to do. You just be there for them. Just being there with them and support whatever that they say or do is good enough for the person. That there's someone there. So your duty, first you have to identify the signal. So your family member may have some signal to say they are doing this, but if you don't pay attention, not mindful, then you miss it, and then you do the act of killing himself. And then once you identify it, so what do you think? I say you accompany them, support them, bring them to see, motivate them, and ask them to see the right people. So I think this is the key for family members to help them. So I think there are some messages that come directly to me. It said for the person's case, this is is it so simple that I go to seek Sayalay's help, then my problem will be solved? I think that's not the right way, because Sayalay will be very busy. So I think you try to attend the retreat and practice your mindfulness, so that you have more awareness of your issue. Okay. I think I've answered most of the questions. Maybe let me see. Is there a common ground where both science and spirituality agree on how to reduce suffering and reduce help the patient with a suicidal intention? So, Sally, maybe you give the final comment on.
No, Dr. Wong, you say first. You know both. You know science. You know Buddhism. So you are the best person to comment.
That's
I
great.
I only know one side. I only know Buddhism, so I don't know all the medical science.
I don't think I can answer this. So that's why I asked the question. Maybe Li Ting, you can answer this. This question is for you.
I think just now we have mentions about this, like in the beginning, Sayalay already mentions, right, mindfulness, social connections, and also compassions. These three things also scientifically found that it's very helpful for suicidal patients, to help them to reduce their stress, to help them to get support, and also help them to forgive themselves and forgive others. Yeah.
Okay. So I think we have been here for more than 1.5 hours. And I will end this session with a comment from this direct message to me, which I think is very positive, from someone who has schizophrenia and suicidal thought, and metta meditation to help himself. So he says here, for myself, as someone with mental health issues, we need to nourish our seeds of happiness. We need to know what we love to do and do the things that nourishes our happiness. For example, I do a lot of artwork, and I'm into singing as well. I have been on psychiatric medication for 30 years, and doing what I love has helped me tremendously. So I echo what he said, and it's a good ending to our talk. And also, teaching from Thich Nhat Hanh has said that there's bad seeds and also good seeds. So you have to feed the good seeds, and so that the good seeds is so powerful, the bad seeds cannot arise from your subconscious mind. So with that, I will end here. Do you have any advice to our audience, Sayalay?
I think, as I said just now, I said before, so before anything happened to us, we better have some weapon first, all right? So if you got time, whether you are Buddhist or non-Buddhist, go and learn metta meditation, go and learn how to contemplate your mind, how to be mindful of your mental state. And not only metta, so you also need to reflect cause and effect, karma and its consequences. We call this only operation of cause and effect, nobody, no he, no me, no she, just a working of the karma without involving a self, a person, right? All these are right understanding. So if you have all this right understanding, plus you have the metta and mindful of your mind and compassion for other people, and I think all problem will be solved lah. To me. Okay.
Okay, Li Ting, final words from you.
Okay, from my side, I think the first thing is we need to reduce the stigma. Most of the time, when we talk about suicide, one of the things that might stop us from knowing the truth is we might feel fear to ask the questions like, are you thinking of suicide? Yeah, I think this question is a very important question for us to understand the difficulties that person is facing right now. Because when the person is having these suicidal thoughts, they might tell people, but then sometimes they might feel shame to let others know. So if let's say we found the persons may show some symptom of suicide, then we need to go to approach them with our kind hearts or kind words, and then to ask the right questions, and then to know the cause, and then know the difficulty they are facing, then lead them to the resources they need. I think that's very important for us. If let's say we don't have any skill about suicide prevention, but then at least we know, we approach them, we care them, and then we accompany them to find the right resources, and until means frequently follow up with them, so ask them whether they do they go to the mental health frequently, because sometimes they went for one time, then they might stop. Yeah, we need to frequently follow up with them until they really means resolve their issue. Yeah. If let's say we found persons who really have a strong suicide intentions, strong suicide intentions, meaning to say that they have plans everything. They plans when to commit, means when to kill themselves, when to buy the things, all the things they had list down. They had list down dates, matters, and when. This is a high risk people. So when we notice this, then probably we need to help the persons. So if let's say we found this issue happens, then we need to discuss with the persons that we might need external help to help them. If let's say the persons means means trying to kill themselves, then we couldn't help them. Probably the last step we need to do is to call the police. Okay, when the police come, the police will actually take the patients to hospital, like to general hospital. So the general hospital, they will bring them to emergency ward. So the emergency ward there, they will help to like calm them down, to help them. Yeah, from there, the mental health resources can go into to support the persons and also the family sometimes. Yeah. If let's say they want to have further information about suicide prevention, they can always in Penang we have one associations we call iLife Suicide Prevention Associations. So in the associations we do provide trainings, tell them what to identify the symptom, and tell them if let's say we identify the persons, then how should we talk to them, what should do and what shouldn't do, okay, and how to help them better. So after they attend the course, then they might need to they will know how to help them better. And most importantly, the course actually is free talk. It's a free one. So if let's say people's means the participant here want to know further about this, then they can message iLife Suicide Prevention Association, inbox us, then we can provide the training as well. If let's say they are interested to be part of the gatekeeper, suicide gatekeeper. Yeah, that's all from me.
I think there was a very important message that you end. Asking the right question. A lot of people are very scared to ask. They say that if I ask a question, that will trigger him to do it more. So from medical point of view, this is not correct. So if you have awareness, we should ask them. And the final message from our friend who has a schizophrenia. For those who don't understand schizophrenia are patients who has wrong understanding of senses. So they have hallucination and also delusion. So perception is wrong. So he said that when I was warded in the mental hospital, I generated compassion to a fellow patient who was suicidal. And that gave me so much inner strength and I recover very quickly. So that's the metta that Sayalay has said. I think
Compassion.
yeah, good. So with that, I will end here and I invite Sayalay to give us her blessing.
Okay, so let us also transfer merit now. I wish all of you be well and happy and have love for yourself and for others. And sometimes what happened in life, take it as a, for me, I also encounter a lot of suffering, but I take all the suffering away to make my heart strong. All the suffering, you know, for me, I thank all my suffering, because all my suffering make me become a very wise person and make my heart, my mind very strong. So train yourself to be strong mind, and also, as I say, love for yourself and love for other people. And okay, finally, let us do some transfer merit, and to all sentient beings, and may all sentient beings also be well and happy. Hitamata jammehi sampadang punya sampadang. Sappe dewa, sappe buddha, sappe satta anumodantu. Sappa sampatti siddhya akasata ca bummaka. Dewa naga mahidika punyatang anumoditva. Cirang rakkantu sasanang, cirang rakkantu desanang, cirang rakkantu mang paranti. Mama punya idang me punyang nibanasa pacayo hotu. Mama punya bagang sabasa tanang bajemi. Te sabe me samang punya bagang labantu. Sadhu, sadhu, sadhu. May all of you be well and happy, free from all suffering.
Sadhu, sadhu. Okay, thank you all of you for attending. This is the recording will stay in the AVMC Facebook, and I encourage all of you to share this video so that other people who are also having the same problem can be relieved partially from it, and try to attend the retreats. And with that, I will stop here. Thank you, Sayalay and Litek.
I also, first of all, wait. I want to, I want to thanks Dr. Wong. I think Dr. Wong is a very compassionate person. He is so busy, with his, as a heart, specialist. He's so busy, and yet now he helps so many people, helps those people who have mental problem, have suicide problem. So I think Dr. Wong is is a practicing Buddhist. He practice compassion in his action, in his mind, in his action. So, how to call? I'm touched by you, I'm touched by your, your great compassion for suffering people. Salute to you.
So you agree that we're going to continue with this series?
No, you can do it better. No, with the another sister. What is the sister?
Liting.
She's such a nice person, and her way of helping other is more acceptable to many people. My way of helping people is very difficult for other people to follow. So I think if you can work with her more and to help more people. Yes.
My wife sitting next to me said that she learned more from you. Okay.
Yes. Those who are inclined to meditation, of course, they can learn from me more. But those who have like this suicide problem or this, then maybe the another sister can help them more than me. Okay. So good night to everybody.
Bye bye.
Good night, everyone.